We are on a mission to save and revitalize independent pharmacy. On the Catalyst podcast, we dive into current events that are shaping how pharmacists approach their patients and their businesses. Fuel your passion for pharmacy, one conversation at a time.
3, 2, 1, 0. Ignition.
Welcome to the Catalyst Pharmacy Podcast. I'm your host, Jeff Key, president of PioneerRx. Today, I'm here with Mark and Marsha.
I'm Marsha Bivins, director of marketing for PioneerRx.
Hi, I'm Mark Bivins, vice president of sales for PioneerRx.
Today, we're here with Tim Mitchell, owner of Mitchell's Drug Store in Neosho, Missouri. Can't believe we haven't met at some point, but if we haven't, I'm sure we will. I make it out to quite a few trade shows.
Yeah, I feel like I know you just because of listening to your podcast and following all the things that you're doing. So you're a very, very, very good leader. So I appreciate that.
I've heard your name 1,000 times.
Yeah.
And I don't know why.
Well, I mean, Trip. I mean, they're all in the same orbit. Like,
Same
he knows
circle.
Trip really well. And
Trip Logan.
yeah.
I saw where his son worked for Melody.
Yep.
Yeah, I like her.
Yep.
So which I like Trip too. Good people.
Yep.
So that puts him
We work with Travis Wolfson
in Missouri.
too,
That's true. You work with the ARC Select guys and stuff like that, don't you? Or PPOK folks and all those everyone. He knows everyone that we've recently
NCPSN.
brought
He's in
on.
all those groups.
Oh, sorry. And this is Marsha Bivins.
Uh-oh.
She'll tell you she's wearing
Mar-
color block today, so she's a little
I'm
fiery.
having fun. Today's a fun day.
That's what she
Fun
said in the
day.
hall. She's like, I'm
Today's
wearing
a
color block,
fun
so I'm
day.
having fun.
What is color block? I'm sorry. What is
I don't
that?
know either.
That's
Me
the-
and you both.
Something to do with TikTok or what?
Is that a TikTok? Maybe.
That is definitely what that guy will tell you.
It's kind of the original one was the coat of many colors, right? So it's kind of just but different squares of
It's a
of
shirt
color.
that has multiple squares, multiple colors.
Control room, pan to the color
so
block.
it's like the thing. Okay, so it's like the thing. Is this dress pink or is it blue or is it
That's
gray
true. I bet
or
there's an element of that.
whatever?
Maybe. Yeah, I remember that. And
Uh-oh,
remember the
but
other one where could you
freezing
hear
up?
could you hear this or this?
Is your wife a shopper? Does she like clothes?
Yeah. We're freezing.
Did you see that? I needed the speech about we can cut stuff, Tim. So
Yeah.
we're friends. So you say what you want to say, and then if we
Don't
cut
get
something,
me in trouble.
yeah.
Feel free anytime to say,
I love
edit that
that
out,
look.
Ace
He was
thought.
like, should I? Shouldn't I?
Not going
You know, how safe is this
Spent
place?
Yeah. I spent all weekend scheduling for a last minute COVID clinic on Monday that we did yesterday. And she's like, when is this going to end? And I said, I don't know if it'll ever end.
Right.
But, we're just trying to get, things scheduled. And unfortunately, we're just scrambling. The great thing about it is we're very nimble. And I got 120 people in here yesterday.
Oh, wow.
Started calling them after church on Sunday. Or sending emails. And I'm like, so what I told everybody was bring a friend.
Nice.
Because this vaccine is going to expire on Monday night at, like 9 or 10 o'clock at night.
Right.
So it was Pfizer vaccine. So I don't know if we can talk about that if you want to talk about it.
Sure.
Let's go ahead.
Absolutely.
Why was it
Whatever.
last minute? Why was it kind of a last minute thing?
We can talk COVID vaccine at this point. We're all vaccinated.
So, it was a vaccine that was the hospital called and said, we have 300 doses of Pfizer vaccine and we just pulled it out of the ultra cold freezer and we can't give it. We need someone to give it. And we know you're active in the community.
Nice.
So what I did was I threw, I've done a couple of things. So on Saturday, well, actually this
I
was
saw
like
that.
maybe Wednesday or Thursday. So we did a drive-through clinic on Saturday, and I just pulled all my friends and volunteers in the area and some of my staff members, and we did 240 shots pretty much within 72 hours of getting this vaccine.
Okay.
And then they said it's going to expire Monday. And I thought I was hoping to give it all on Saturday, but we weren't able to do it. We had a successful day. I'm not
Still a really
complaining.
good day. Yeah.
Yeah.
But then we realized we actually have more than 300 doses of vaccine. We gave 240 and we still had another 100 I thought left. It ended up being 120 because those vials are overfilled.
Yep.
And so I just started calling people, or actually sending emails on our list that we have And I just opened it up to whoever wanted it, as long as they were 16 and older. My son started calling his friends. And,
oh, wow.
We had 75 people by the end of the day on Sunday. And of course, I made some posts on social media.
Sure.
When I walked in our pharmacy yesterday morning, the phones were ringing off the hook, and they're like, "What did you do?
What happened? What happened?"
And we don't have an IVR, so everybody was answering, and I just said, "Just tell them to come in. Just tell them to come in if they want a COVID shot." And then we were screening them at the door, just making sure. But most everybody understood. I put some that they need to be 16 and up and so forth. But I can tell you, it was quick and just, very fast and furious. I guess that's the word I'm looking for.
Yeah.
But we had a very successful, and it went smoothly other than the phone calls first thing in the morning. So
so it's really cool. Like subtitle here, you had a relationship such with the hospital that when they needed help, they said, call Tim.
Yeah.
So if you're a pharmacy and you're listening and you don't know the person at the hospital, doesn't know your name, get on that. But the question there, though, is you kind of got these extra. What are they going to do about the second dose for you? So everybody got their first. You can't really schedule them for the second dose because you don't have it. Oh, you did?
We did.
Oh, okay.
Yeah. So when we, and I assume you say you guys have all been administered vaccines. So on the back of the card, there is a place. And when they're here, we're saying, you're going to come back the same, or in 21 days, we put that date on there.
Okay.
And we're going to say it's going to be the same time unless it just doesn't work and you want to move it around. But to keep it simple, we're scheduling it whenever they're in here getting their first dose.
Okay.
And they're looking at their calendar going, yeah, that'll work. Or, that's not going to work. I said, just call me the day before. We'll move it, or just come in when you can come in. Second dose, we're doing a second dose Pfizer clinic from 21 days ago today, actually. I had to bring in another pharmacist today to be able to get these things rolling. But I can tell you, second doses are much easier than first doses because they already know and they want to get it.
They're ready.
And they're coming in.
Right.
Yeah,
that's true. But you got extra supply for the first dose that you weren't originally allocated. How will you make sure you get allocated the second dose?
The same way we got the first dose.
Okay.
And I'm not trying to be rude here. I'm sorry, but the hospital says we will get you those 300 doses again.
I gotcha.
So we're going to have another drive-through to give them the second dose on Saturday, and then whoever got it on Monday will also get it on Monday. Now, I will tell you, it's if they miss that drive-through dose, they can still get it on Monday. So we told them there's a couple of day window there, that we could work with.
Are you going to get some extra doses so you could give people maybe their first time?
Well, so then it gets a little more confusing because that could happen. And I used every single drop of the Pfizer vaccine yesterday that we had. And in fact, I had someone call last night it was 5:45 and we closed at 6. And she's like, I heard you have some vaccine. I said, I have 2 doses left. And I said, if you can grab your neighbor or friend or whatever and bring them. And she goes, let me call my son. And she came down and she showed up by herself. And I said, where's your neighbor or friend? And she said, I couldn't get anybody to come. Everybody's, busy or whatever. And she said they wanted it, but they were busy and couldn't get down here. So I turned and looked at my technician. I said, have you had your dose yet? And she's like, no, I haven't. And she's like, I'm due for my second dose. And so we just went ahead because she was sick when her second dose was supposed to be given. So long story short, she got the last dose.
Yeah. Wow.
So it works out.
Yeah. Interesting thing on my Pfizer, they scheduled my second one for 28 days and asked them about it. And they said it's up to about 7 weeks.
Yeah. It's weird because I got mine. Mine was 3. Josh had the same thing. Yeah. Josh had the same
4 weeks
because y'all all went to Baylor.
Yeah, but they had 3 weeks at Baylor.
Mine's at 3. Yeah, I don't know. I don't know.
I was told I'm going to get a text message with my next appointment.
But they were like, we just do what the computer tells us to.
I know, right? It's just one of those, they're probably just booked for the 3 weeks
out of our control.
They're usually always trying to go, hey, let me give you the same date and time that you got last time. And it's probably
Yeah, I think they had some problems with their like second dose clinic or something. They had a delay, but it was interesting. That was a puzzling. I had to like,
You're like me.
I will tell you guys. So talking about relationships, and and I don't know if this is the direction you want to go with this, but so our local health department, which to give you a little backstory, right before the pandemic hit in January of 2020, we had a meeting because CPSN Missouri was rolling out with trying to connect with, Tripp Loken in Southeast Missouri had just found a possibility of getting a HRSA grant with working with pharmacies, community health workers, and health departments and helping them screen patients for various conditions.
He's such an animal.
He is. He's amazing. So what I said was, Tripp, I want to have a meeting with my local health department. We just got a new director. And he's like, let's do it. And so he wasn't able to be on the call, but I got Michaela Newell, our director, on. I think she came down, and we had a meeting with him. And when we walked in, I said, I've been hearing weird things about this coronavirus. I said, I wonder what's going to happen with this. And he goes, who knows? And before we know it, we had our meeting, and we were talking about collaborating together. First meeting we ever had. Lord knows that we would be collaborating together in different ways.
Yeah.
So we have. Before we even got vaccine, they started getting some, and we actually sent some of our technicians and our pharmacists to help them do their clinics. And he's like, "So you guys having trouble getting vaccine?" And we were, initially it was just kind of all confusing. I was doing my share of yelling and complaining to the state, but long story short is he said, "Why don't I just order you some in? I'll allocate it to you." And guess what? We got vaccine the next week.
Wow!
And it wasn't because we went and volunteered. It was because we had that relationship.
Yep.
And so to bring it a little bit further, and I don't know all the ins and outs, but he said, I have 2 nurses and they both quit on me last week, and I can't give second doses until I get these new nurses. And then he's like, "Can you help me?" I said, "Sure. Tell me what you need me to do."
Yes, let me figure it out.
So we have helped them with a couple of second dose clinics. And he's like, "I'm not going to schedule any more first dose clinics. So any vaccine I get, I'm going to have to send to you." And I'm like, "Okay, that's fine." And now we have more vaccine than, that's why we're trying to do all these relationship things and working on trying to get these things through. I have more work ahead of me than what I probably realize, but making these connections is really key. Now, I will tell you, I'm going to take this, and you can stop me because I get to rambling, but I will take this the next level and say, I'm still working on that original conversation that I had back in last January. And I'm proving to our community and to our health department and to our local hospital that we want to work with people and we're a valuable resource in this community. And there's things that we can do very nimbly, just in a very, is nimbly a word?
It is now.
Very quickly. It is now. Yeah.
Just made it one. Trademark it.
Thank you. Yeah. Yeah. Put that on Wikipedia or whatever.
Yeah. We'll put it in the Urban Dictionary.
Yeah. So I think us being nimble and seeing that we can fit in some of these places, COVID has created so many opportunities for independent pharmacies, and you guys have seen that, and independent pharmacies seeing that. And if we're not taking advantage of that, then, I don't mean in a bad way. I mean, just stepping up and saying, hey, here we are. I'm not, I know the big chains are taking people's personal information and marketing it in other ways. I'm not doing that, but I mean, I'm stepping out here. I mean, I've got 3 or 4 people waiting right outside my door right now after their vaccine. So, and I'm just going out and saying hi. And if you need anything, let me know. So,
you're absolutely
so great
marketing to those.
They're getting one of these. They're getting one of these with everything.
Right. Yeah, but you're marketing those people not by calling them later, send them something in the mail. You're marketing them by being efficient and being friendly and all those things that they're not going to see in
at
other
a CVS
places.
or a
but it's like the best kind of marketing, which is like you get to create an experience for them. And,
You're right.
and one they get really impressed by.
So I think for all new pharmacies that open or ones that we convert to Pioneer, we should send them a T-shirt that says "No relationships, no future."
That's so true, though. Like Tripp said the same thing, and
we hear it again and again and again.
Like I know everyone in my community, and maybe
Larson
not everyone, but like your health department, your public health department, whatever that is in your
you could also say region. No, yes, no future. And seems kind of
literally
weird.
The last one we just did was like it's just about being available sometimes and just saying yes when you're not sure.
Because those guys that say, "Yeah, Tim's going to figure it out. I got a problem. Tim's going to figure it out." And
well, unfortunately, my wife said, "What are you working on?"
Stop saying
now?
yes.
Yeah. You know, I think there's a movie that says the Yes Man or something like that or whatever. I unfortunately I don't say no very often, and that does get me into trouble. So I do have people in the store, and of course I do need to realize I need to balance my personal life with my professional life. But when you're an independent pharmacy, you are married to this, and you know my wife says my pharmacy is my mistress. I say that lightheartedly, but sometimes she gets really irritated at me.
So I like the M word, but the pharmacy is your mission.
Yeah,
true. There you go.
Probably,
I need to tell her that.
It's probably
there you go. Now.
It's probably clearer. And what an amazing mission that is, right? If you were put here to care for people, is there any better place to do that than a pharmacy in a small town? So.
I think God, I'm a Christian, and I think God puts things in front of people, and you need to then figure out how to do it. But God puts a brain in my head to figure out, okay, that is a good thing, and I need to do that. I need to do this for my community or do this for my family. And, I do feel that we have a big mission with COVID and everything else, but I do want to carry that on. And I know many independent pharmacists are doing that. And when I say take advantage of a situation, I think it's important for us to step up. This is an opportunity. Yeah. It's not a time where people should feel burdened, although it sometimes can be very time consuming. Making calls and trying to.
Well, the initial setup is always a burden and always stressful. But then once you get that ball rolling, then it's just, okay, it's another knob I'm turning over here.
You're right. I compare it to building a road. When you see those big mountains. So down south of here in McDonald County into northwest Arkansas, where the Walmart country is, they're clearing some mountains and putting new interstate in there. And when you first look at it, you're like, okay, they're going to put a road through there. Yeah. And so now they're in the process of knocking those mountains down. There's a big hole, and they've got their gravel down, and they're getting ready to lay pavement. And then so that's where we're at. I think we've knocked the mountains down, and we're plowing through, smoothing things out, and we're going to put our asphalt down, put the lines on, put some signs up, and that's going to be our freeway for the future. So I don't know. That's what I tell my staff. They look at me like I'm crazy, but
have any of the
I look at Jeff that way a lot.
Yeah, he does.
Yeah, we both do. It's like you want me to do what?
I look at me like that a lot too. Madison's looking at me like that right now. But have any of the improvements we've made in Pioneer helped on the COVID, or y'all taking advantage of those?
I will tell you, I'm not the most technologically advanced individual, and so I struggle with some of the things. So I have to have my staff come in and show me. But I will tell you, we mentioned my son, who's in his third year at UMKC. He works for Melody Savely at Alps, right. And they're Pioneer customers. And I'll tell you that he came to me last year, and he's like, "Dad, if you're going to work for the future, for what you're saying, you really need to move to the Pioneer platform." And I said, "I don't want to switch computer systems. Are you crazy? We're in the middle of a pandemic." I mean, it was last summer.
Yeah.
And I pushed it off. And I said, I don't care to spend more money, or I really don't want to spend more money, but we can do that. But, and of course, my staff, he was here. I don't remember when it was. I think he came for a week over the summer and was spending some time with me working and talking to my staff. And they're like, "We need to do this. What he's saying, we need to do this." And so I got peer pressure from my son. And so, and I was going to push it off. And in the fall, I said, "You know what?" Of course, my previous system was continuing to frustrate me because I couldn't get things done that I needed to get done. And I will tell you, I just made the call and I said, what's the soonest you can get me set up?
Book it.
Yeah. And the next I mean, that afternoon and the next day, we were filling out forms to get you guys here. He's like, I can get here. And I probably shouldn't say this because there's probably going to be people getting mad, but they were in here and installing within like 3 weeks. It was crazy. I was very impressed. I'm not saying everything went completely the way I wanted it to go smoothly wise, but I do feel like we made the right decision. And so, the changes, it reminds me of when we first started with our previous pharmacy system, 20 years ago, back in I think it was 2000. And, I could have conversations with the owner and the management and tell them, hey, this is what the problem is, or I would like to see this. And they made those changes. And I know you guys are very versatile, and I appreciate that. I'm still learning. So I think the changes that have been made have been good. And again, it's the way I operate. I think the nimbly word, you guys are nimble, and I think that's important. So
yeah, and the downside with nimbly is it doesn't always. Sometimes we nimbly in a bad direction.
Yeah.
And, but sure. That's if you can quicker make 3 steps forward and 1 step back, and 3 steps forward and 1 step back, you're at your destination quicker. And we have a lot of frustration. We had some stuff with SMS, I think, over the last 2 weeks. That's frustrating because we're all trying to do the right thing, and I think we're going to do some redirections there. But one of the things I thought about though this week is that several years back we kind of changed our mission, and we really went from, if you talked to me 10 years ago, what was our goal? Sell pharmacy system. Everything was about selling pharmacy systems. Should we do this? Does it sell more pharmacy systems? If it doesn't, don't do it.
It was make more money, have more fun.
But that was the slogan for the customers,
yeah.
Right? But really our goal and how we used our mindset to decide what we did was to sell more pharmacy systems. Is it what people are looking for today? We switched about 3 years ago maybe to save and revitalize independent pharmacy. Our goal is actually to save the profession of independent pharmacy. It makes you think differently. It makes you think how, if I do this amazing thing and 3 people use it, I didn't save anybody, right? And sometimes that is not directly the same as selling pharmacy systems, because independent pharmacists, they're independent for a reason. You talk about herding cats, you talk about all these kind of things, but you gotta move. We had an interesting thing this week. We rolled out an SMS kind of that we learned from Bob Lomanak, where the last SMS says, hey, you haven't picked up your scripts. We're going to put them back and let your doctor know to update your medications, right? Well, that's bullying. We wouldn't tell a patient's doctor that he didn't pick up his prescriptions. Wouldn't you?
He needs to know.
As a dispenser, pharmacy doesn't have a future. But as a member of the coordinated health team, a care team, if the patient's not taking their drugs correctly, the doctor needs to know. If for whatever reason they decided.
That is actually a good point as far as helping pharmacists into making that first foot in the door. Like, hey, this patient didn't pick up the scripts. Because if you don't have the data of the patient to show them, the first thing is, I don't have any data because this patient's not picking up or taking their meds. What do you recommend?
Yep. So I understand the feeling of a mission and how it's a struggle at times, but it's all
back to the mission.
But it's good. Not
the mistress.
Not the mistress.
Yeah,
it's the mission.
It's the mission.
Also,
I like it.
I looked and I usually I try to make some time to talk to everybody before they jump on the podcast, but I researched a lot. And first, a mildly humorous note: whoever's in charge of your website is pretty spot on, hilarious, because there's this little picture of you at 28 years old telling everybody that pharmacy's not stressful, and it's a picture of this really old guy.
I think that's like the #1 meme in a bunch of pharmacy stuff. Starting out.
It's really subtle, but man, you find it just made me. I laughed out loud when I saw that. Yeah. But
so foot and mouth. So you're saying he looks older now?
I feel left out because I didn't look at the website.
Yeah, we'll get it pulled up.
Q website.
Right. Yeah, right. They're pulling it up for us.
We'll get it pulled up.
Pull the website and inject it here.
I think it's the meat. I think it's the
MitchellDrug.com.
Yeah. But again,
MitchellDrugs.com.
No S. Mitchell Drug.
Mitchell Drug.
Yeah. So a friend of mine put this website together, and so he and I were being humorous, and I sent him a bunch of pictures. He pulled that one. Somehow I accidentally sent that to him. He pulled that one out and said, "I'm putting that one in." I'm like, whatever.
Oh,
Sorry.
I think people want to be part of people that don't take themselves super seriously. Right?
Sure. Yeah.
I was mining kind of your website for some stuff you guys were doing, and it looks like you guys are, again, though, like it's kind of a common theme with all this COVID preparedness, fairly prepared as much as you could be because you're already doing testing. And I think you guys already were CLIA waived and all that. Yeah. So speak to some of that preparedness. And you guys offer like appointments for just getting an injection for like some of the injectables you guys are doing.
All right, I'm going to shift it and make the question a little more broader. So of all the stuff you were already doing before, you said COVID opened doors for independent pharmacy. And I absolutely agree that. What would you say COVID has opened for you in the way of your business?
Specifically COVID? I mean, not necessarily looking at, where I was going to go with this. Sorry, I'm going to backtrack to his question.
Yep. You're good. Okay.
So back in, I guess it was the late 90s, probably 97, I started doing influenza immunizations. Okay. And, I just went to a training at Missouri Pharmacy Association in Jefferson City, and they're like, "You're going to be one of the first ones in the state to do this." I'm like, "Cool, yeah, tell me what to do." So we started administering really basic protocols. I just had a local doctor sign. He didn't even know. He's like, "Yeah, sure, it sounds good." And so, but that opened doors for me because he's like, you're going to take a lot of this off my shoulders because everybody's wanting a flu shot from me. And I had pharmacies call me going, "What the heck are you doing?"
What are you doing?
And I go, what do you mean? He goes, "That's for nurses and doctors." And I go, "It's for pharmacists now. And that is going to be the wave of the future." And he's like, "You're crazy." Huh. Well, the guy eventually worked for me down the road. He's a nice guy, but he still refused to give immunizations. And so he didn't work for me much longer. That being said, opening other doors, going into point of care tests, my wife back in 2003, 2004, had a pulmonary embolism and about died on me. It was a scary deal. Oh, man. And actually she had 3 pulmonary embolisms in the same instance, but they put her on Coumadin.
Okay.
And so I was talking to her, it was, afterwards, and she was on Coumadin, and she was taking like 15 milligrams of warfarin a day. And I'm like, geez, this is killing me. I'm brand name Coumadin, as we stuck with that. Still could, it was all over the place. And she was having to go to the hospital. This local hospital made her check in as an inpatient to get her test done. It was crazy. She's like, "Tim, it takes 3 hours for me to get a ProTime or an INR." And I said, "We can do this better." And so I started doing some investigating, ended up getting a Coagucheck machine. Spent some money on that. And they're like, "Oh, Tim can do INRs. We're going to start sending Tim all these INR machines or all these tests." Blowing me out of the water. I was doing them all day long, every day sometimes. It was crazy. And it just started with, my instance with my wife. And I thought, I'm just going to buy it to just make it easier for her. And then I got thinking, we can do other point of care tests. So I bought a Cholestec machine. We did cholesterols. We did, of course, normal blood glucoses. So we actually started making our connections back in the early 2000s, late 90s, with local providers. Some of them didn't really know what we were doing, if we were even authorized to do it. But most of them were very supportive of what was going on. And I didn't step on toes. Right. I sent them flyers. I said, "Hey, if you want someone to do it, send it this way." So moving into COVID, many of these providers knew that we would be jumping on this board right away. Now, we didn't get the test right away because, we wanted to make sure whatever we had was a valid test. We didn't want to start doing some things that weren't, and it was moving very quickly. So once we evaluated the right test, we ended up using the BD Veritor tests with the analyzer and everything. And I don't know if I can use names, but long story short,
nobody.
Okay.
You're fine.
Long story short, we started offering those tests. And then we also were able to get some antibody tests and so forth. So specifically with COVID, we had conversations with our local travel agency because they're wanting to get things back open. Right. And they're like, "What can we do?" Now, I think they've been able to find a way, but I helped them. local businesses. Neosho is, a pretty heavy blue collar community, and there's a lot. We have a Lazy Boy factory and a factory that's lots of different, factory workers, and that need help. And they're like, we need to get our places back open. And I'm like, let me know what I can do. And, we help them with hand sanitizer and other things to get their store back open. Long story short, I think I've had more conversations with HR directors and people in all these factories than I have all over the last year than I have over the last 20 years combined. Wow. And we've done flu shots for a lot of them. So they knew who we were. They knew we were pretty active, and we didn't just put labels on bottles and send them out the door kind of thing. And I know you hear this story a lot, but I think those relationships through COVID has blossomed. And, I'm actually working on getting some COVID vaccine for the Lazy Boy chair company here in our community. They employ about 750 people. One of the bigger. Yep. This is only a community of 13,000 people, and they're just super, super excited. So go ahead.
Yeah,
I don't know if you had another question.
He answered your question.
I know,
and then he merged into Marsha's question.
Did I answer your question, Marsha?
You did.
Yeah, because you talked about how COVID created the extra relationships because of.
Are you a politician?
That was really good.
No, and I'm not going to be.
It's like, man, that was smooth.
Probably not in the future. It's probably a good thing.
No. So you have some of those. Are some of those, and this is a tangential kind of, but are some of those, like your Lazy Boy factory or whatever, are some of the self-funded plans that I don't know. Is there an opportunity there to manage?
Oh yeah, there is actually,
and like
and I'm having these same conversations in the same process.
Right.
So, and I'm not trying to take advantage of people.
Right. No.
But when I build their trust and they understand that, like my local school district, I've supported many of the things that are going on in the school district, financially, personally. My kids go to school here, and we've had conversations with the board. Many of them are our friends about how insurance works, because a lot of them don't even have a clue. I assume you're talking about the PBM industry and so forth.
Yeah.
And they're like, really? And so the superintendent, actually, I was working with two superintendents ago, and then the last superintendent, and now the new superintendent. And I can tell you, it's not an easy road, because, they have 1,000 people in this school district. They want to make sure they're insured well. And they're, we're not going to go to some weird, and they're good people. But when I show them what's going on behind the scenes, it kind of blows their mind. Yeah. And with all the stuff that's been going on with, talk about PBMs and so forth in Washington, D.C., and even in our state. I mean, we have Express Scripts in Missouri. Right. And it's kind of hard to talk about without them kind of getting involved in the chatter. But I will tell you, they're starting to open their eyes. So yes, there's opportunities. I hope I'm not carrying it too far, but I'm involved with RX Select and MaxCare as I sat on the Unify RX board, which is PBA Health and PPOK combined.
Right?
Yeah. And so we see what's going on with MaxCare and what kinds of things they're doing. MaxCare is a transparent PBM. They work really hard for independent pharmacy. I'm looking at trying to set up a plan for my employees here through MaxCare, and I think this could be a great thing. Pioneer needs to do this for their employees too. There's nothing more than what I look at. I buy from Cardinal Health, and my rep comes in and he wants to get a prescription. He pulls out the card, and guess what? It's through CVS Caremark.
Yeah. Yeah.
What the heck?
Yeah, I know, right? I hear you.
Support me. Don't support CVS.
I know. Yeah. We have an infinite transparent PBM, everyone.
Yeah. Sorry. Just to know. So I think sorry, I hope it doesn't create a problem for you guys on this. We have to edit that part out.
It does not.
I will tell you, I'm preaching the message along with being supportive and everything that we can do with COVID. And it gives us an opportunity that, like Marsha said, I think it's opening doors for us and creating more conversations that we can have. I don't hit them over the head with it all at once.
Yeah.
I'm like, hey, we talked about that a while back. Would you be interested? Our local physician that's actually signing off on all of our protocols now, he was at our COVID clinic on Saturday. And he's like, I forget all the things that you guys can do. And I'm like, we need to sit down and talk some more because I've talked to him about doing work in his clinic is connected to my downtown store. So it's a simple process. And I think we could actually do some work in his clinic very easily because our door is right there, beside one another. One of our other stores is inside of a federally qualified health center. And we've had meetings with them as well about doing this. Now, putting the model together and being a pioneer about trying to make sure, work that word in.
Yeah,
pioneer.
I saw that.
I know.
Yeah, very good.
Like
being a pioneer in this community and trying to coordinate some collaboration between our pharmacies and the providers. Some of the providers are not real sure what's going on. You trying to take over my business here?
Right.
I'm the one that's in charge of my patients.
Right.
So we don't try not to step on toes, but using this opportunity to say, we're here to help you. And we want to collaborate with you. We want to be a healthcare provider. Yeah. Right now, we don't have provider status. I think that's coming very soon, guys. And, in our business here, we're changing our culture. And you guys mentioned this just earlier. Again, trying to make that, we're still dispensing and we're going to continue to do that. But we're looking at trying to make our main flagship location a central fill. And our other two stores are only like 2 or 3 miles away. So they're not far away. So why do we need to stock inventory, large amounts of inventory in all 3 locations? Do it at this one location, cut our inventory maybe, by a third, and still have, some basic things at each of those other stores. But it's, Pioneer will give us that opportunity to do that. Yep. So I do feel like we're working through this. I know not all my employees are completely convinced that it's going to work, but most of them are like, okay, this is cool. This sounds fun. I think we can do this. And it's a challenge. Yep. So anyhow, that's where we're going.
On the testing that you were doing, how did you bill for that?
Like the INR or
the cholesterol, all the different types of machines that you got for testing. Were you able to bill?
Yeah. So, like I said, this was early 2000s. Most of those things were cash.
Yeah.
And, we didn't charge a huge amount. I covered the cost, and I think we were charging, like $35, $40 for some tests. And most people were willing, because they said, my copay's $50.
Yeah, your copay is,
Yeah. Right. So you're actually saving me money, and I don't have to wait for 3 hours. I can, I can't say we did everything by appointment model. I tried, but they would call and say, hey, do you have time to do an A1C on me? And I'm like, yeah, sure. Come in at 2:00. And I didn't have an acuity scheduling or anything else like that going on. But I wrote it down on my book, all right, so-and-so's coming in at 2:30 for an A1C. And I do think that was the beginning of my appointment-based model. And, I can remember when I was working the bench by myself, if I needed to do a diabetes consult that took more than 5 or 10 minutes, I would schedule them before or after work. And you probably hear that all the time. And so people would come in, right at 6:00 when we closed. And as the techs were closing things down, we would sit in the back of the pharmacy together and go over their situation. Or if it was a night where we had I started a diabetes support group that met once a month. We had 50 people coming to that thing. I had to move it to a local church because I didn't have enough room in the pharmacy.
Oh, man.
And
Nice.
It was a time where, people would come and ask questions and it was a free thing. But the diabetes consults one-on-one, I did charge. Not everybody could pay, but I did my best to try to, make it a part of the business. And that's kind of where it grew.
You said did y'all not do that anymore? Do you not have
COVID
meetings?
kind of killed us.
COVID killed it. Okay.
Yeah.
Because I always wonder why a Weight Watchers model or something like that, a coaching model, doesn't work for a pharmacy. Like every church would let you meet there with people and have a weekly weigh-in and coach session where somebody stands up and says something motivational and where you educate people about smart choices and somebody speaks about that.
COVID has kind of killed like any kind of gatherings.
Yeah.
So, but now it's all Zoom.
And we do have a challenge. I mean, we're pretty rural. There's a lot of individuals that aren't really, they don't have good internet, so it's hard for them to get on a call. I will say some people have surprised me, though. I had an older gentleman come in just yesterday, and I said, well, I'm going to need you to register on this site if you can. If not, I can get one of the girls. And he goes, I know how to do that. And he was like 90 years old. And I was like, this is cool.
I got this.
But, many of our people don't use internet or don't have internet access, and they have a phone. They still have their own dial-up party line phone that they
wow.
Maybe not party. No, but we're still pretty rural, and Southwest Missouri's pretty spread out. And I will say that most people are very attentive to the internet and be able to make their own appointments. That being said, we've talked about trying to figure out a way that we could start up the diabetes support group again, and make it where it's safe for everybody. But I'm hoping we can get back to normal here.
You keep vaccinating the heck out of people. Yeah, maybe it'll get there.
Yeah,
more vaccine clinics at the local church.
Yeah,
so,
there you go.
You've talked a lot about your son who's in pharmacy. You have 5 kids.
Yeah, you have been stalking my Facebook page.
We've been mining your social media.
That's how we prep. We look over websites, social media.
Marsha's all about that. She's like, okay, is that the son or is that the son-in-law?
Right.
Yeah. No.
Well, let me tell you about our family. So, my wife and I. My wife is not a pharmacist, but I say my wife and I went to pharmacy school together. We were high school sweethearts. We went to college together, both graduated with education degrees. I was a science teacher and a coach.
Oh.
She was a vocal music teacher.
Huh.
We lived in our hometown community where we grew up. Well, I grew up in a community just east of here called East Newton, Granby area. But I taught in a different school district. She taught in the school district that she grew up in. And after about 2 or 3 years of teaching, I came home one day. She was pregnant with our first child, Tyler. And I said, you're going to shoot me, but I want to go to pharmacy school. And she's like, what? I'm pregnant.
What are you doing? What are you doing?
Crazy. She goes, well, she was shocked at first. And then she's like, well, if you're going to do it, let's do it.
Let's do it now.
So I sent applications in. I was accepted to 3 different places, and one was in Weatherford, Southwestern Oklahoma State University, KU, and UMKC. And I don't know if you guys are Jayhawk fans, but I told her, I said, I don't know if I can be a Jayhawk.
You don't know if you can be a Jayhawk.
And Southwestern Oklahoma, great school, very rural, very, very rural. And she's like, well, I'm a teacher, and I don't know if I can get a job down there. And so UMKC, of course, is University of Missouri in Kansas City. She said, I think that's probably the way to go. So you're going to be a kangaroo. So I'm like, well, maybe Jayhawk is not so bad.
Maybe Jayhawks aren't so bad.
No, but I'm a proud kangaroo. Okay. Right. I went to Missouri State University. I was a bear. And so I went to kangaroo after that. But so I was accepted, and I didn't tell them that my wife was pregnant when I applied, because I don't know if that would have been bad or good. But, you think about, okay, well, we'll say they'll let me in. So when I showed up for the orientation thing, they said, bring your family, or, bring your wife or, friends. And most of the people were bringing their moms and dads. I was bringing my wife and kid. But there were others that were married as well. I thought I would be, unusual. But long story short, we started living in the Kansas City area. We lived just south of Kansas City, Raymore Peculiar, and she was a teacher. And we thought we were going to stay there. And that something was just telling me we needed to move back to Southwest Missouri after I graduated. Graduated in 96. I may be going into too much detail.
No, this is interesting. No, super interesting.
You can edit out what you want to edit out. But,
we mine all of that stuff.
And while we were there, we actually had our second child, and everybody was like, "Are you crazy? You're in pharmacy school, right?" And it's like, my wife's got insurance; it's all covered, so it's fine. And we did. we lived in a mobile home, so we had some equity that we could sell. We didn't have a lot of money. We pretty much did everything on our own. I had a lot of pharmacy school debt and previous school debt, but I mean, I considered it an investment. That being said, we had 2 kids when I graduated, and then we thought, well, we got our perfect family. And then I got my license, and we found out back the same week that I got my license, we were pregnant with our 3rd kid. And my wife's like, hey, this is great. So I'm like, I didn't know if we wanted 3 kids, but Tanner, we have Tyler and Taylor, and then Tanner is our 3rd child. And he's the one that's actually in pharmacy school right now at UMKC. Nice. And Tyler is a pastor in Bonner Springs, Kansas, just outside of Kansas City. Taylor works for a clothing store in Oklahoma City. She is actually a manager of the Buckle Corporation. I don't know if you've heard of that, but again, I don't know if you have to edit that out. But yeah, they have great clothes. So I get good stuff for Christmas. I can tell you that. Sometimes I don't know what it is. I'm like, well, these are skinny jeans, and I'm not skinny. I'm not sure how to wear them.
I'm not sure what to do with them.
Yeah,
I'm not wearing them.
She keeps me somewhat in style. I still go back to my shirts that I've had for 20 years occasionally back in the closet. But anyhow, so then. My wife and 3 kids, and we're moving along. And she was sick in the early 2000s, had the pulmonary embolism and all kinds of things going on. And we're like, okay, I think we'll be, good. And then a friend of ours was involved in mission work overseas. Okay. To make a long story short, before long, we're realizing we wanted to adopt a couple of kids from Africa. Oh, cool. And it wasn't just because it was the going thing. It was because our friend kept saying, do you want to give money to help us do things? We'd like for you to sponsor a kid or whatever, because she was trying to genuinely help kids. And so my wife and daughter went over. Actually, they went to another country. But long story short, we ended up taken a liking to a couple of twins in the village of Hope in Ghana, Africa. Okay. And their names were, at that time, Prince and Princella. And they've changed their names now. When they come to America and you get a birth certificate from the United States, you can just change your name. I didn't know you could do that.
Just be whatever you want to.
Go through the legal stuff. Yeah.
I didn't know that.
So, I think I could have been Prince. You could certainly have been Princella.
Yeah. Well, their names are still, their original names from Ghana are still in their names. So we have Tegan, our daughter is Tegan, Tegan, Hope, Princella, Aziedu Mitchell. Oh, so I don't know how we're going to get that on their diplomas. It'll work out. And then Talon's is Talon Justice Prince Aziedu Mitchell. So their names from Ghana are in the middle of their name. And so Talon and Tegan, we took our whole family over in 2009 and spent a month over there with the twins. And they were 5.
How old were they then? Okay, 5.
Yeah, they were 5. Yeah.
No, the 5 is a cool age because they think you're amazing. That's when the kids think you're.
That is when.
Yeah.
It's where they go before they go through the stage where they think you're stupid.
I feel like that was my peak.
That was your peak.
That was my peak coolness with my kids.
Peak coolness. Yeah. Well, I will tell you, having our other 3 children with us really helped, and we even brought my father-in-law too, because what happened was the older kids had to fly back because they had to start school, and we went over Christmas break right at the beginning of the year. Okay. So. We left like right after the new year. I think we went on like the 2nd of the year, January 2nd. And my father-in-law went along as kind of a moral support chaperone for the younger kid or the older kids. Long story short, they spent 2 weeks and then they came back and started school. My father-in-law, it's a good thing he had the older child that could navigate, because I guess they got lost in Kennedy Airport, and Tyler's like, "No, Grandpa, we got to go this way."
This way, man.
Their flight was late, and it was a mess. But long story short, they got home, and so Michelle and I spent the last 2 weeks of January with the twins, getting all their paperwork ready, and Accra, which is the capital. So when we came back, everybody met us at the airport, and we had 5 children, and we had all kinds of learning to do to be parents, because we thought we were on the tail end of our parenting career and we were just getting started again. Wow. Michelle has been a rock, and she like I said, she's a dance. I guess I don't tell you. She was a dance teacher and voice teacher, so she did a lot of things. So she quit teaching, and I was, of course, running the pharmacy. My staff was great, by the way, by that time, because they let me. They're like, Tim, you need to take the month off, and so I even spent another month spending time with the kids, and I would just come work periodically. Long story short, it was amazing, and God had a amazing connection with trying to get everything put together for us. There was a lot of times that it was like, are we supposed to do this or not?
Right.
So we have 5 children. Right now, Tyler is the oldest, Taylor, Tanner, Talon, and Tegan. They wanted to be T names. That's why they changed their name.
I got you.
And then, and my name is Tim.
Right.
And then my wife is Michelle. And I tried to get her changing her name to some T names.
she wouldn't do
She
that.
didn't want to do it.
I don't know, Giselle maybe?
Yeah, I have a whole thing. So your
Michelle?
wife is music and dance. We have a whole Van Champ thing going on here.
Oh, I bet there's a lot of music going on. I bet
Doe
there's
Deer.
some good noise in the family.
Yeah, they
in the
are.
house.
They're all great singers. They're my son is a pastor, so he leads a lot of worship in their church and has his guitars and various things. He plays the keyboards. Just about everybody sings. I'm not a great singer, but I do what I can.
Let's hear it. I'm kidding.
Yeah, no. That's right.
No, all right, fine.
So that's about
Fine.
me. And my son, he's going to be in his final year doing rotations at UMKC next year. Starting in January or June, actually, right after this year's done. He's not doing a rotation here because I told him and guess where he's going? He's going to Trip Logan's store.
Wow.
And I told him, I said, you need to learn everything you can at Trip's
Bring
store.
some of that over.
Yeah.
Yeah. And he's going, doing some hospital rotations and things. And he's thinking he wants to come back and work. We'll see. We'll have to kind of wait and see what's going on. I'm not trying to pressure him to do anything he doesn't want to do. The pharmacy market's kind of weird right now with, trying to figure out things that, initially he was thinking he wouldn't be able to find a job. And now he's saying, well, gosh, everybody's got jobs now, but are they temporary? Are they permanent?
Right.
What's going on? So
there'd be a huge opportunity if you wanted to be there to get into some of that in doctor's office stuff that you want to do to help with what are the measures?
There's opportunities there for like annual wellness visits or remote patient monitoring.
Yeah, doctors'
all of
offices
that.
have their own 5-star that they have to,
all the
that
MIPS,
they're missing out on.
improving all their MIPS numbers and all that. There's a lot there.
Yeah.
That he could do. It sounds like he can sell Pioneer too. Just
that's true. So he's welcome to spend a couple of months at a bunch of different pharmacies. Maybe he just needs to be a traveling evangelist, right? Just a different kind of evangelism. Evangelize the Pioneer. That's Well, Tim, I think we're about out of time. What a joy this was. So nice to.
Well, I appreciate you guys giving me time to talk. So.
Get to know you a little bit and just hear
Love the story about your family.
Your amazing story. Yeah, Marsha,
big heart about the adoption because we don't keep it a secret, but my husband adopted my daughter. When she was 2.
That's awesome.
Yeah,
that's awesome.
So,
I married. I liked her a lot, so I had to marry Marsha.
Yeah.
That's what he follows with too.
They came in a package.
It was a package deal.
I couldn't get Mackenzie without Marsha.
Yeah.
So I had to marry Marsha.
But my wife is an amazing rock. She puts up with a lot of stuff for me, and I don't tell her enough that I appreciate her. So.
Good.
Yeah,
So if she watches, she'll hear it.
Yeah,
I know. My wife watches all the
Michelle.
podcasts too, and she's like,
right.
Well, this is your chance.
And she's like, what? I didn't know that.
I know. You're right. Yeah.
Oh yeah, you got in trouble over the chocolate pie.
Yeah. What? You like your favorite chocolate pie? I was like, yeah. So it's like, Ma, hey, honey, that's some of it's
on TV.
It's supposed to be happier. You love Mom and apple pie. It's entertainment.
Yeah, I know. So. I feel like we're gonna have to have you back on. There's things we didn't cover.
I know it. I know.
We barely touched the list.
I know.
Look for it. You go
do you have a list?
They give us these beautiful prep notes my team puts together.
Yeah.
And we barely touched on any of.
So good.
It was fun.
The families.
Are you going to NCPA?
Oh yeah, I actually sat on a committee, the state legislative committee, and I'm planning on. Hopefully, we will have an NCPA.
Well, please come by and say hi. And
is Unified doing theirs yet, or do you know?
I don't know. I think it's probably going to be virtual again.
Yeah,
I don't know. Or actually, we didn't even have one last year.
You didn't have one, right?
Yeah, it got canceled last year.
I didn't know if they were still doing it. I think they were trying to book it for the end of July this year.
End of July.
I'm ready.
Yeah.
So
I'm ready to see.
There's going to be so many people.
I want to be where the people are.
Yeah.
No, I agree. I think the Zoom platforms have been great and all these, Skype and all the other things, but goodness gracious. I'm ready to go meet some people and work on some things. And, it gives me ideas. I talked to my Cardinal guys. They're the RBC's going to be virtual this year.
Yep.
So they said I guess Denver's the next one that they're going to have. So anyhow, I do miss it, and I'm ready to get things somewhat back to normal. So I don't know if they ever will be back to normal. You're talking thousands of people, but
I'm with you. Zoom has kept me from being depressed.
But
I'm ready for more joy.
Right.
So, all right. Well, thanks again, and it was great talking to you.
Tim,
nice
good to have you on.
Appreciate you
Thanks
guys
so much.
All right, bye.
Thank you for watching the Catalyst Podcast. If you enjoyed this episode, please consider liking, subscribing, and/or following us. Give us a 5-star rating on Apple Podcasts to help us reach more amazing pharmacy people like you. Follow PioneerRx on your preferred social media platform for the latest up-to-date pharmacy news and content.